Good afternoon, everyone. We welcome you to another live session of an important webinar at Prime Health page and or on our YouTube channel named as Prime. My name is Fahad Shahid, and today we are here to discuss an important topic that is on vitamins. As you can see on your screens, are you taking vitamins? This is going to be a very important topic. We have with us Dr. Shipra Rai, who's specialist internal medicine at Prime Medical Center, Kasmia, Sharjah. She's currently practicing there. She has an extensive experience of 9 years, uh, and she is in UAE now practicing here. We've got a lot of queries, a lot of people wanted to understand and ask about the vitamins. That's the reason we've made the topic today. Should you be taking these vitamins, or which are the right ones for you? And especially, we are going to talk about the insights of vitamin D and vitamin B12 deficiency. That is, a common thing in UAE, specifically when you talk about people living in here. That's an important topic today. So, without further delay, the doctor is going to talk about vitamins, of course, in the beginning, and after that, you are more than welcome to ask your questions, put in the comments, and we will be answering your questions live. The doctor is going to answer the questions live. So, Dr. Shipra, thank you very much for joining us today here.
Thank you so much for the kind introduction.
You're welcome, doctor. Doctor, as we are into, a lot of people want to take vitamins for XYZ reasons. There are many reasons. You know, some people take multivitamins, and some are into vitamin D and vitamin B12 that we are going to especially compare and talk about today. So, doctor, what do you have to say on this vitamins, especially, please?
Okay. Since I think it's an honor for me to be here today to talk on something that is very important and very relevant, I feel, in today's times, because everybody has been exposed to so much of vitamin news and on social media, on WhatsApp, on Facebook. And with the pandemic that is raging in the background, I think it becomes very important that somebody tries to clear all the doubts that you have in your mind. Whether it's important that you take, whether you need to consult your doctor before you take the vitamins, how much of vitamins should I be taking, and how long should I continue the vitamins for? Is there an alternative to taking vitamins? Anything like that. There are many questions in people's minds. But before I start answering the questions, I feel it's important for you all to understand what is vitamin so that you have a clarity on what vitamins you need to take in your daily living. When we talk about vitamins, generally they are micronutrients. They are substances that are needed in very small quantities in your body to perform various functions in your body. It's important for your mental and physical well-being that you start your body has enough of vitamins, even from fruits or even from diet or from supplements generally. So there are two forms of vitamins that are mostly important. When we talk about vitamins, it's basically fat soluble vitamins and water soluble vitamins. When we talk about fat soluble vitamins, usually they are vitamin A, D, E, and K. When I talk about what fat soluble vitamins, it basically is in the name itself. When you're talking about fat soluble, it means that vitamin is dissolved in fat. So the chances that when you start taking supplements, the same vitamin gets deposited in your adipose tissue or fats in the body is higher. So suppose you start taking vitamin supplementation in excess, there is a chance that a toxicity and excess, the symptoms of vitamin toxicity can develop. When you talk about B complex vitamins, generally it is B complex vitamins and C vitamins. When you're talking about C vitamins, B and C complex vitamins, generally they are replenished daily, as in whatever you take in the food is utilized and little amount is only stored in your body, in your liver, or in case of any other organ. So whenever, suppose there is not enough from the diet, there's a chance that you might develop deficiency much faster than you would if in case of B complex vitamins. And another important fact about B complex vitamin is that the chances that you will develop toxicity because of B complex vitamins is quite less. So since vitamins are such a large topic, so it becomes difficult for me to answer everything. So I'll try to make it as simple as possible so that you understand whether you need to take vitamins or not. See, whenever you're taking vitamins, generally what are the sources for normal common vitamins? Whenever we talk about common vitamins, it includes your vitamin D, it includes your B complexes, it includes your C vitamins. So if you're having a good dietary habits, as in you're including enough meat, enough cereals or nuts, or enough oils in your diet, and especially fruits, if you're taking enough of that, there is a chance that whatever you need for your body every day is provided by the diet in itself. So generally, who are at risk of developing vitamin deficiencies? So usually the most common reason why people develop vitamin deficiency is because you're not taking enough from your diet, or your diet is not good enough. You're eating more of one group of fruits or one group of foods, or you're not inculcating enough vegetables or fruits in your diet. That is one of the most common reason that people develop vitamin deficiencies for. There might be other reasons, maybe because your whatever food that you're taking is not getting absorbed enough in your body, maybe because you're on some tablets that are not allowing the vitamins to be absorbed in the body, or you might be suffering from some malabsorption syndromes wherein whatever you're taking via food also, it's not getting absorbed from the stomach nor from the intestines. Another important thing for us to remember is, even if you've been suffering from some kidney disease or liver disease, because most of the vitamins are either metabolized or stored in these organs. So if you're having any disorder of kidneys or liver, you might want to consider getting yourself checked if you're having any deficiency or not. Next important thing for us to remember is, like, what are the symptoms and signs that you need to look for? Do you really need to get yourself tested, or how often do you need to get yourself tested? See, important thing for us to remember is, most of these vitamins will not have any symptoms initially. You might remain asymptomatic for a very long period of time. You might be having some niggles, some aches, and some pains, or some dietary maybe some gastritis or some weight loss, hair fall, or something like that, which is been, but you will not concentrate too much on it, or that symptoms may not be enough for you to seek medical advice. But only when the vitamin deficiency becomes moderate to severe is when you start showing symptoms. And should you wait till the symptoms appear? I would say not. Like, what you can do is, regularly if you come for your checkups, and if required, when the doctors ask for symptoms regarding specific vitamin deficiencies, he might or she might ask for specific tests to be checked whether you need vitamin supplements or not. See, again, what happens is, when you start uh, another question that arises is, should I self medicate? Again, the question is no, because especially when it comes to fat soluble vitamins, suppose you take anything in excess, it gets deposited in the body. So after some period of time, there is a chance that you might develop toxicity because of the vitamins. So it is always better to talk to your healthcare provider or your doctor regarding whether you need to take supplements or not. Next thing is, how do you diagnose vitamin deficiency? When you talk about vitamin deficiencies, generally, again, most people remain asymptomatic. Suppose you seek medical care, the doctor might advise for some blood tests, which might include some tests to see whether you are anemic, or there are some changes in your blood, or they might ask for specific levels, including maybe vitamin D levels or vitamin B12 levels, to see for how severe the deficiency is. Why do we need to check? That is another question. So because the doctor needs to customize or give you your supplements based on the amount of deficiency that you're having. If the deficiency is very little, maybe if it's mild, the doctor might just tell you to make some dietary changes or add certain foods into your diet, so that you're able to take care of the deficiency on your own without any supplements. Suppose your deficiency is moderate to severe, so then the doctor might advise you to take certain supplements based on the amount of severity, and he will also advise you on how long you need to take the supplements for. Next important thing is, suppose you start on, I think everybody has this question whenever I prescribe it to any of my patients. It's usually the most common question I get is, for how long should I continue the supplements? I think, again, it all depends on what vitamin deficiency you're having, what is the severity of the vitamin deficiency, and for any other, if you're having any other comorbidities, like you're having some malabsorption, some liver disease, or if you're having some reason why the whatever you're taking as through food is not getting absorbed. So then usually the recommendation is to monitor yourself regularly, at least once in 3 to 4 months, to see if the deficiency has been reverted, or do you need to continue the supplements for a longer period of time. I think this actually sort of breaks down the vitamins into a little bit simpler format, so that you're unable to understand better.
Thank you so very much, doctor, for this initial
Yeah.
information that you've given. It was really, really informative.
Yeah.
Doctor, coming down to the questions,
Mm.
actually, that is really important. A lot of
Yeah.
people want to understand.
Yeah.
First of all, my question to you, doctor,
Mm.
is that some people are taking vitamins during the food. Some may take it an hour after the
Mm.
food.
Mm.
What is actually the right time to take a vitamin tablet?
So I think it's a very common query, and we don't generally ask the doctor also. And I think it's a good question to ask. Thank you to some whoever asked this question. Actually, generally the recommendation is to take vitamin with food, because generally what happens is like it needs to be broken down along with your food so that the absorption happens better. So the timing does not matter. You can take it morning, afternoon, and night, but better is to take it along with food as a
Along with
general.
food.
Yeah, yeah,
Okay, just in case if somebody's already in the practice of taking it after the food, maybe an
yeah,
hour or
yeah.
something, is it going to be less, what do you say, effective,
Mm.
or there will be any?
No, usually what happens is the best absorption happens along with food. The absorption amount may be lesser compared to when you take it with food. So that's the only
Absolutely,
difference. Yeah,
absolutely. I
yeah,
understand. Thank you so
yeah,
very much, doctor.
yeah.
For
Mm.
answering that
Yeah.
question. I've got a question, doctor. Should we really take the vitamins directly? For example, if a person has a report coming in for vitamin D is less, or should we directly start taking multivitamins, even if not only vitamin D, or we should consult a doctor first and then go for a specific vitamin tablet?
Yeah. Nowadays, I think that's a very good question, because nowadays, especially in the area that we live in, we are not exposed too much to the sun. So vitamin D deficiency becomes very common. But before you start taking vitamin D, since it's a fat soluble vitamin, the chances that the risk of toxicity is higher. And the dose that you need depends on how much of deficiency you're having. Suppose the deficiency is severe, you might need a higher dose of vitamin D for at least few weeks to months before we start you on daily supplementation. So it's always better to contact the doctor before you start on medications. Always.
That's right. So before start taking the medication, we should definitely go and see the
Yeah,
doctor
yeah,
so that we can get the right vitamin for ourselves.
yeah,
Doctor, there's a question that we have here
yeah.
is, how do I know that I have vitamin deficiency? What are the main symptoms of it? Not
Yeah.
specific to one vitamin, and
Okay.
generally, in general, if
Okay.
I'm asking.
See, generally it depends on, because vitamins are involved in every vital function of your body. So depending on the vitamin that is deficient, you might be having different symptoms. But the most common symptom that most people come with is generally unexplained body aches and pains, which they don't know why it is happening. One of the reasons may be vitamin deficiency. Another important thing for you to remember is people, and especially B complex and all, because it's involved with the formation of red cells. So people might come with anemia and symptoms of anemia, that is easy fatigability. They might be tired all the time. Fatigue may be the common thing. Other important things to remember is hair fall might be there. You might experience dry skin. You might have some ulcers in your mouth which have been going on for quite some time. You might have some joint pains which are unexplained. These are the common symptoms that are seen in most of the vitamins, and especially in case of vitamin D, you might have some aches and pains. That is, I think, the most common manifestation what people have, low back pains which are unexplained. These are the common symptoms in most of the vitamin deficiencies.
Great, thank you. Thank you so very
Yeah.
much, doctor.
Mm.
I've got another question here. Mr. Mohammed Rais is asking, doctor, can you please tell me what is the symptom of vitamin D deficiency?
Yeah, like I mentioned, vitamin D deficiency is quite common. So when you have vitamin D deficiencies, you might have various aches and pains. Usually, vitamin D is important for your bone and your muscle. So whenever that is involved, so you will have some muscle pains. You might have some weakness getting up, usually in the proximal part of your limbs. You might have some unexplained myalgias, and you might also develop, if it's severe enough, you might develop calcium deficiencies also. So then you might have some fractures, which is unexplained for your age. So you might need to get yourself evaluated for vitamin D deficiency generally.
Great, thank you.
Yeah.
Thank you so very much, doctor.
Yeah.
I've got another question here. The question says, doctor, what vitamin can I take if I have anxiety? And is there any side effect on that?
That's a very good question. Actually, many people have certain vitamins are important for your mental well-being. Actually, so some of the people have, like, because B complex vitamins especially are involved with your nervous system development. So suppose you're deficient, you might develop some anxiety, insomnia, some depression. So better is to get yourself checked for especially B12 deficiencies, which is quite common even if you're taking a lot of meat. So it's better to get yourself checked. So I would recommend getting yourself checked for B12 deficiencies first, and then take vitamins, especially B complex, depending on the doctor's advice.
All right, great.
Yeah.
Thank you so much, doctor, for
Yeah.
the answer. Uh, Another question here: what is the which vitamins are good for the underweight child at age 17?
Okay. When you thank you for that question. When you talk about underweight and when it's 17 years old, there are two factors. So when you're talking about 17-year-olds, usually what that means they are teenagers. That means your energy requirement of your body is quite high. So you burn more calories than you would take through normal food. So first thing that I would recommend is just look at the diet that the child is taking, whether there are enough nutrients coming through the diet itself. If not, I would definitely recommend B complex vitamins because they are helpful in energy production in the body. They also help to produce RBCs in the body, and vitamin D supplementations with calcium because your bones are still growing. So you need a lot of vitamin D and calcium so that your bones don't become weak. I would definitely recommend B complex and vitamin D especially.
Thank you. Thank you so very much, doctor.
Yeah.
I've got another question here, doctor.
Mm.
The question is from Miss Usma Khan, and the question says, numbness in hands,
Yeah.
usually after sleep. Is this vitamin deficiency?
Thank you for that question. See, there might be many reasons why you would develop numbness of your hands. See, if depends on if it's one-sided numbness you're developing or both the arms you're developing numbness. See, most common symptom may be because you're compressing some nerve because you're lying down on that side. Other reason why it might be happening is because your nerve is getting compressed from where it's coming down from your neck, which is quite common also in most of the people. So some of the vitamins in itself can cause this kind of symptoms, but it will be in a prolonged period of time. Suppose you're deficient in vitamin B12 or B6 generally, you might develop this kind of neuropathic pains that you're having, which is numbness. So you might as well consult with your doctor first before you start medicines on your own.
All right, great. Thank you. I've got another question. Mr. Michael is asking, until what time vitamin D to be taken? What is the range we need to have?
Okay. Thank you for that question. And I think that is very, very relevant for today's talk. Generally, the normal levels of vitamin D is between 20 to 60. That is the cutoff that we give, that is picograms per ml. 20 to 60 is the normal. So between 12 to 20 is when we say there is vitamin D insufficiency. That is not deficiency, it's insufficient in your body. Anything less than 12 is called deficiency. So generally, if it is just insufficiency that is between 12 to 20, then you might need supplements just for maybe 3 to 6 months. That is high dose vitamins for at least 3 months and followed by daily supplementation after that. But if you're having deficiency, that is if your levels are less than 12, you might need to continue high dose vitamin supplementation. After 3 months we need to recheck you whether your vitamin levels have come down, and then decide on further management. But generally, what the most important thing to remember is vitamin D and calcium are like best friends. So whenever there is a prolonged vitamin D deficiency, after some point your calcium also comes down. So your bones start becoming weak after when it's less than 12. So if vitamin D deficiency, severe vitamin D deficiency is there, it's better to supplement even with calcium along with vitamin D. So that is why you need to get yourself checked before you start on vitamin D supplementation.
Great answer. Thank you. Thank you so very much, doctor,
Yeah.
for that detailed answer. I've got another question here from Mr. Zahir Ahmed, and this is a long question, so I'll just. Supplements are quite common in current pandemic.
Yeah.
What are the requirements to make your immune system strong? Is it good to take vitamins from pharmacy?
No. No.
Okay.
See, I think because we are you read a lot of things on social media, you read it on WhatsApp, you read it on Facebook, because everybody recommends taking vitamin C, zinc, and I think this one, vitamin E especially, and nowadays vitamin D also is being prescribed. But generally, as such, if you're maintaining a very good healthy dietary habits, as in you're taking good amounts of fruits and vegetables especially, you don't need vitamin supplement as such. There is nothing called immune boosting. It just helps you to respond to the infection. So what you can do is, suppose there is no evidence to show that any of the vitamin supplements that we have been currently taking will help you to fight infections. So all you can do is, if you're taking vitamin B complex or C, there is no harm, but make sure that you're not taking any other drugs which interfere with the B complex or C. So make sure you ask your doctor before you start yourself on vitamin supplementations.
Great, thank you very much, doctor.
Yeah.
I've got a question here from Ms. Shaista, and she's asking, does skipping doses of supplements, or do I have to take it forever?
Nothing is forever, as long as your diet is quite good and you're taking good food and you're nutritionally, your weight is okay, and you're having enough sunlight exposure. There is no need to continue vitamin supplements beyond 3 to 6 months, unless you're diagnosed with any condition which makes you whatever food that you're taking doesn't get absorbed, or because the supplements that you're taking isn't getting absorbed. That is the only recommendation where you need to continue tablets or supplements for a longer period of time. There's no recommendation.
All right. Just wanted to just continue the question. Actually, she just corrected her question in the next comment, and she's saying, does skipping doses of supplements will have any side effects?
No, there will be no side effects to skipping doses. Just that suppose you're deficient, the response that you need to get from the vitamin may take a longer period of time to show, because it will take longer for the body's stores also to fill up. So it might take a longer period of time to see a response. That is the only thing that will happen. Yeah.
Thank you very much, doctor. I've got a question here from Ms. Susan, and she's saying, doctor, I have severe eczema.
Yeah.
Which vitamin I can take?
So usually, thank you for that question. See, usually when you talk about dry skin, it might be related to vitamin D, or it might be related to something called niacin, because that is very common to cause dry skin. So you might want to supplement on B complex and get yourself checked for vitamin D deficiency before you start on supplementation. Even vitamin E, for that matter, helps with your skin development, your skin. So it's very common to have vitamin A deficiencies when you're having dry skin too. So you might want to start on A, B complex, and D especially.
Thank you, doctor. Yeah. Doctor, an important question related to vitamin B12, as we mentioned in the beginning of the topic, that we are going to talk about vitamin B12 specifically also. Doctor, for a common person, for a layman, what is the importance of B12 in the body, and how do we find out the symptoms of vitamin B12 deficiency?
Can you repeat that question?
Yeah. What is the importance of vitamin B12 in the body?
Yeah.
Okay. Where do we find the effectiveness, and what is the symptom? What are the symptoms of vitamin B12 deficiency?
Okay. See, vitamin B12 is generally involved in the formation of red blood cells. It's also involved in the formation of genetic material in your body. Another important function is always that nervous system maintenance is by B12. So suppose you're deficient with vitamin B12, you might develop anemia. That may be like, it might take a little bit longer period of time, but anemia is one of the common symptoms of vitamin B12 deficiency. Another important thing for you to remember, since it's involved with nervous system development, you might have some tingling, some numbness might be there, sensations might be impaired in all your hands or toes, and you might develop some neuropsychiatric manifestation. That means you might have some maybe insomnia, irritability, you might be having a depressed mood. These are the common things that are seen in case of vitamin B12 deficiencies.
Thank you. Thank you so very much, doctor. I've got a question here. All right, so doctor, talking related to vitamin B12 itself only, I wanted to ask a question. The question says, I have vitamin B12 deficiency. My feet and hand are extremely burning, and my body as well. I am unable to sleep entire night. Kindly suggest me what I should do for this problem.
See, that what symptoms you're describing probably looks like peripheral neuropathy, and vitamin B12 is just one of the causes that can cause peripheral neuropathy. Even other vitamins like pantothenic acid, which is not really spoken about, can cause this kind of burning sensation that you're having. So I would definitely recommend you to go to the doctor once, get yourself examined, because whether it's really B12 deficiency or there are any other vitamin deficiencies that are also there, and get yourself supplemented accordingly.
Thank you. I've got a question here, doctor. I have a leaky gut and supplements don't get absorbed easily, and I need to take them for longer periods. Vitamin B12, and vitamin D. What can be done for this?
See, when you're having these kind of deficiency, it means you're having some malabsorption syndrome. That means whatever you're taking orally or whatever food that you're taking is not getting absorbed enough. The only way to bypass this is to take the supplements as an IV. So basically, injection, that's what I meant. when you're talking about vitamin D, it can be given as an IM or an IM injection generally. Even via vitamin B12, B1, B6 can be supplemented as IV, not daily. You might need to take it once every month or so, but that is a way to get around when you're having malabsorption syndromes. That is the only way to treat malabsorption syndromes generally.
Thank you, doctor.
Yeah.
I've got more questions here.
Mm.
Miss Batul is asking, I'm having thyroid. Can I take multivitamins?
Yeah, there is. Thank you for the questions. There is no contraindication not to take multivitamins. Again, B complex vitamins are generally safe, even if you don't require it in excess. Require it in whatever is in excess will be excreted out through the urine, so there is no harm. But when you're taking vitamin D supplements, just be a little more cautious. Make sure you're taking it for a limited period of time, and always consult your doctor before you start on vitamin D supplementation.
All right,
Yeah.
doctor. Thank you.
Yeah.
I've got a question here from Ms. Usman again. The question says, hair fall and acne or scars on face.
Yeah.
What's the reason for this, doctor? Even after taking vitamin D and vitamin C and biotin.
Okay. Thank you for that question. Hair fall, acne, vitamin deficiency may be just one of the reasons why you're developing that. Even iron deficiency, as such, if you're having B12 deficiency, or it may be some thyroid disease that is causing you. And there is another reason why it can happen is called polycystic ovarian syndrome. So there are many, many reasons why it may happen. Vitamin deficiency may be just one of them. So make sure you talk to the doctor, get yourself examined for other deficiencies also before you start on supplementation.
Perfect. That's
Yeah.
great. Doctor, what are the consequences of vitamin D in childhood, I should say, if there is anything?
Okay. See, when it's a growing age, generally when we talk about vitamin D, it's mostly involved with your bone health along with calcium. So, because the growing child is always, because the bones are always growing in a child as they grow up, at least until the age of 20. So, whenever there is vitamin D deficiency, the bones become softer than they should. So, whenever there is softer bones, the chances that you will develop something called rickets is higher. That means your bones, the child's bones can get bored, or the patient might have some softer bones. Because of that, if it's an infant, you might have some flattening of the skull bones also. So it is important that vitamin D is supplemented throughout childhood, so that all these complications of vitamin D deficiencies are not seen.
Thank you, doctor.
Yeah.
Another question from Ms. Ayam. The question says, what is relation between vitamin B12 deficiency and low back pain and spinal issue?
Thank you, Dr. Hyam. I just when you talk about vitamin B12, like I said, it's involved with the nervous system development. Suppose for a prolonged period of time you are deficient with vitamin B12, the covering of the spine, that is the myelin, can get degenerated. Because of that, what happens is whatever nerve stimulation that happens from the spine can get impaired. Because of that, you can develop some tingling, numbness. You might develop some weakness which is unexplained. You might develop some food drops. These are the common symptoms of B12 deficiency in case of whenever it involves the nervous system.
Wait, doctor, a very important question coming
Yeah.
in related to COVID now.
Yeah.
Mr. Sajid has asked this question. What does vitamin D have to do with COVID-19?
Thank you for that question. And I think it's a very relevant question in today's time. Vitamin D generally has a very important function with immune system activation, usually when what we call it as innate immunity. So if vitamin D is deficient, your innate immunity response may be impaired. But as such, till now, from whatever research that has been done, there is nowhere that it's shown that even if you take vitamin D, the COVID risk of COVID becomes less, or the severity of COVID becomes less. So there is no clear cut evidence to show that vitamin D in any way helps you to recover from COVID, nor does it prevent you from getting COVID-19 infection.
Okay. I hope the answers, you answered the question. The next question says from Ms. Kavita, could it be that vitamin deficiency is just dizziness while sleeping?
Can you repeat the question?
Could it be that vitamin deficiency is just dizziness while sleeping?
It can cause, but it may be. See, that is one of the reasons of dizziness can be because of multiple reasons, especially when you're lying down. It may be because it may be related to your anemia. It may be related to your ear, and I think it's a very gray area as such whether to say it is related to vitamin deficiency itself. it is one of the causes of dizziness. Like suppose you have B12 deficiency, you might develop dizziness as a consequence.
Thank you very much,
Yeah.
doctor. Shrani is asking a question. Can vitamin C be taken by diabetic patients?
Thank you for that question. Vitamin C generally is a safe vitamin to take unless you're taking some tablets which are like especially blood thinners. If you're on statins, that is some of the tablets that help to control cholesterol, because usually diabetics generally have these medications in their tablet portfolio. So if you have been taking those tablets, you need to be very careful, because vitamin C has generally an interaction with these tablets and it might decrease the efficacy of those tablets. So it is generally not recommended as such. If you are on those tablets, better not to take vitamin C supplementation.
Okay, so
Yeah.
that's a very important thing that
Yeah.
you answered. Very important question. Another question from Ms. Sujata. Do people recovered from COVID have to take vitamins for long term? How long and which vitamins?
Okay, thank you for that question. Once a recovery from COVID happens, usually when the body is going through a lot of stress, lot of vitamins are used up. So during the recovery process, that is a viral asthenia process. So it is, you can take vitamins for 3 to 6 months, but there is no recommendation to continue vitamins beyond that period of time, because it is not known to be beneficial at all. So I would recommend you to talk to your doctor whether you need to continue to take supplementation based on your symptoms and not beyond 6 months.
Okay, thank
Yeah,
you.
yeah.
So Mohammed Gauss is asking. Actually, it's a question related to a doctor. Child age of 6 is not taking any fruits. We can give vitamin D injection or supplementary.
No, again, get your child checked for vitamin D deficiency, then only supplement based on the levels. Whether he needs supplements for a long period of time or is it only for a short period of time, depending on it in his deficiency, then the doctor will decide whether he needs supplements or not. But right now, not recommended to take it without consultation.
Absolutely.
Yeah.
Dr. Ms. Reem has asked question. What are the symptoms of iron deficiency?
Iron deficiency is very, very common. So when you're talking about iron deficiency, iron is involved with the red blood cell development basically. So when you're talking about iron deficiency, generally it is related to anemia. So if you're having anemia, you might develop easy fatigability, you might get tired very soon, you might get palpitations, you might feel like when you're walking you get breathless. These are the most common symptoms, but if it's prolonged period of time, you might develop some swelling of your limbs also. Your nails might show some changes. You might have some hair fall. You might have dry skin. These are the common symptoms of iron deficiency.
Great, thank you.
Yeah.
Miss Anshali Tiwari is asking a question. Which supplement should be taken in case of very high hemoglobin? The the number figures are hemoglobin, I believe, 19, age is 27, not living in high altitude.
Okay. So when you're talking about hemoglobin that is very high, it generally does not need any vitamin supplementation as such. You need to get evaluated why the hemoglobin is going down, because there are multiple reasons why polycythemia happens, which is very high hemoglobin levels. So better vitamin supplementation is not generally recommended.
Thank you very much,
Yeah.
doctor. I have a question here, doctor.
Yeah. Mm.
When should multivitamin stop by COVID patient?
No, thanks for that question. See, generally, COVID does not warrant vitamin supplementation. Suppose you're having a lot of weakness post COVID, you can take the supplements up to 3 to 6 months, but there is no clear cut guidelines which say when you're supposed to stop the supplementation. But usually, maximum what we generally prescribe is up to 3 to 6 months, not beyond that.
All right,
Yeah.
thank you.
Yeah.
Another question. I am a 78 years old person who's
Yeah.
already taking sugar, cholesterol, blood pressure medications
Yeah.
on a regular basis.
Yeah.
What vitamins will be benefit for me for normal requirement, or even if I can't take full meal like normal healthy person?
Okay, see, when you're there are two things to two aspects to this question. I feel one is their age, and one is that you are having other premorbidities. So when you are 78 years old, your bone health is a little bit. Your bones will be a little weaker than a normal person's. So generally, the recommendation is to get yourself checked for vitamin D deficiency and get vitamin D supplementation. That would be ideal, and if required, calcium supplementation based on your diet. The other supplements which we would recommend is maybe B complex depending on whether you're deficient or not. Other vitamins are generally not recommended to be taken.
All right, great. As we are moving towards the end of the session, I'll just ask a couple of more questions and we should proceed towards the ending. Doctor, back pain is more while using AC. Is that due to vitamin deficiency or any other reason?
See, back pain can happen because of various reasons. You might be lifting your child. That may be the reason why you're developing back pain. So generally, back pain means if the spine is involved, it's a different story. But if it is, even if it's a disc that is a problem, so generally for the recovery process as such for the nervous system, as in the nerve to get recovered, usually your B1, B6, and B12 generally help with the nervous regeneration. So I would recommend you to definitely consider taking B complex vitamins.
B complex vitamins. Okay, great. Thank you. Doctor, what causes vitamin A deficiency and what is the good source of vitamin A?
Vitamin A as such is mostly derived from animal food, basically your fish, eggs, or your chicken. Anything like that will provide you enough vitamin A. But if you're a vegetarian, a form of vitamin A called beta carotene gets supplied from all your green leafy vegetables and any vegetable or fruit that is orange in color. That might be your carrots, it might be your pumpkin, any apricots. All these are very rich sources of vitamin A. So if you're deficient in vitamin A, again, you might develop some problems with your vision. You might develop some blurring of your vision. You might have visual difficulties, or you might also develop dry skin. These are the common symptoms of vitamin A deficiency.
All right, great, Doctor. Thank you. Thank you so very much, Doctor. Moving towards the end of the session, I've got just one more question here. Mr. Faid Azam Khan is asking, my feet is burning and I'm unable to sleep at night. Even the room temperature is less than 20 degrees. What is the reason? And I am a diabetic patient.
Okay. See, thank you for that question. See, it all depends on how long you have been a diabetic also, because diabetes in itself is known to cause this kind of complication, which is called peripheral neuropathy. That's a burning feet that you're having. So if you're having those symptoms, it is better to take vitamins definitely, because even vitamin deficiency as such can cause these kind of symptoms. So I would recommend you to consult with your doctor to see for how long you've been having the symptoms and whether it is related to diabetes or it's related to vitamin deficiency, because even pantothenic acid, which is one of the forms of vitamin, can cause this kind of symptoms, which is like burning feet syndrome, especially when you're in the night, whenever it covers your feet. These symptoms are quite common.
Thank you, Doctor. Doctor, does the intake of vitamin D preparations protect against cancer or other diseases?
No, there is no clear-cut evidence to still state that. Especially, I think there is a lot of research going on currently, but there is nothing concrete right now to suggest that if you take vitamin D supplements, it will protect you from all the cancers, autoimmune disorders, or multiple sclerosis. There is not enough evidence.
Right. Thank you very much, Doctor. Doctor, is the consumption of vitamin D tablets or foods enriched with vitamin D necessary? How much vitamin D is contained in foods?
Generally, the understanding is that people usually the most important source for vitamin D is as such your skin itself. If you get exposed to enough sunlight, that is at least 10 to 15 minutes in a day, your body itself should be able to produce enough vitamin D for you to sustain throughout the day. But most of us, when we live here, because the sunlight is so harsh here, or the winters when we get ourselves covered too much, so the chances that we develop vitamin D deficiency is quite high. So a general recommendation is, if you want to take vitamin D supplements, it's the general requirement is about 800 to 1000 units per day. So you can contact your doctor first, see how whether you're deficient in vitamin D, and take supplements according to the amount of deficiency that you're having.
Thank you very much, Doctor. Doctor, just one more question coming in. Doctor, please tell, this is again from Ms. Anshuli Tiwari, the one you answered earlier regards to hemoglobin. Doctor, please tell which test should be done for high hemoglobin. As I read, it's very dangerous.
No, thank you for that question again. See, when you're talking about polycythemia, that is increased hemoglobin levels, there are few reasons that it might happen. The most common reason is if the person is smoking. That in itself can stimulate the hemoglobin to go up. So before we need some blood test to be done to evaluate. So what I would suggest is better to get your hemoglobin rechecked once again, get a peripheral smear, and get an RBC mass. That is to see how much of RBC cells are there in your blood, to see if it is really elevated or is it because of dehydration you're showing a elevated hemoglobin count. And based on those results, I think we can further evaluate with an ultrasound and EPO levels. Those are all the next set of tests that are done for polycythemia generally.
Great, great,
Yeah.
great. Thank you so very much, doctor, for answering all those questions.
Yeah.
I'm sure it was really a very informative session. We've got a lot of appreciation coming in also from people who have heard you today, to whom you've answered the questions. Doctor, before we end of the session, I would really like you to give a take-home message related to vitamins. And as we are in the current pandemic, so many people think that vitamins are really helpful. So, what do you have to say before we end of the session?
Vitamins as such are known as supplements for a reason. They are just supplements. When you talk about your daily food habits, as long as it's healthy, you don't need supplements at all. When you take supplements, it's an add-on to your daily dietary habits. So never compromise on the food that you're taking. Make sure you're having enough vegetables, enough fruits, enough meat and dairy products in your diet, so that you don't need to take supplements as such. This, I think, should be practiced by everybody, and never take vitamins without consulting with your doctor, because some of the vitamins do cause toxicity also.
Great. Thank you so much, doctor, for this informative session. I believe people who are watching at this time and people who will watch it later, they will definitely get a lot of knowledge out of this session, for sure. Just before we end of the session, I would really like to tell you that once again, the doctor Shipra is currently practicing in Prime Medical Center, Kasmia branch, that is in Sharjah. She's the internal medicine specialist, and her practicing hours are in Sharjah, Kasmia only. If you want to book an appointment for her for any concerns that you have, you're more than welcome. You can see the Prime Health Me app message at the bottom of the screen. You can download the Prime Health Me app, and you can always book an appointment with her. Or if you're out of the internet, never mind, you can always call on 047070999 and book an appointment with the doctor as per her availability and schedule. If you've got any questions, you're more than welcome to send us at myprime@primehealth.ae, and we will be coming back to you with your questions. Your recommendations, your feedback is really, really, very important. We would really request you to please give us your feedback on our channel, YouTube channel, and on our Prime Health page, where we can bring you more better sessions on awareness of on healthcare. Once again, thank you very much, everyone, for joining us. Stay safe, stay blessed. As doctor said, that vitamins are really important. We should definitely be taking, but before taking the vitamins, do consult your doctor to take the right medication and the right dose on vitamins, as this is definitely the need of the hour also in this era. Thank you very much once again. As Prime is all about personalized care personally, we will be coming back to you with another important live session next time. Thank you so much, doctor, for your time. Thank you,
so
everyone.
much. Yeah.
Take care. Bye bye.
Bye.